I think if you have a vitamin that has 1,000 or 1,500% of your daily allowance, there's a problem there, because if people take that over a period of time, it can actually accumulate in your body and be toxic. So I think within 100, 150%, I think it's okay. I think people are not going to worry about it. But in general, when you, again, the mega vitamins, or when you have such high doses because you want to show folks in marketing that you're giving more than you need, and of course, bigger is better, right? Ain't always true, we say, in Texas. It ain't always true that it's bigger is not always better. Is that in some vitamins, you can really have some problems. Also, not everybody needs iron. Women who are menstruating may need iron, but men do not need iron. In fact, there are certain liver diseases that can happen if you accumulate iron over time. And one of the things that I see, if somebody comes in with a disease with iron overload, I often ask them, do you take a vitamin with iron every day? Especially men. Unless you're bleeding or you're anemic, you don't need to accumulate iron, which your body doesn't readily get rid of or eliminate. So I think that you have to really be careful. Again, as a physician, I think that the conversation with your healthcare provider is critical. Bring the darn thing to the office and say, what do you think about this, doc? And if they don't give you a right answer, you may have to find someone who does. But in general, when patients show me, I said, this is okay, or this is not. So really have a partnership. I think many places in the world, there's a very, it's not a partnership relationship with your doctor or healthcare provider. It's a very disconnected one. But as a consumer, make it a partnership. So make sure that you get what you need. And you have to have some guidance. Don't always, think the internet is going to tell you, because it's jaded. Don't think that the commercials on TV, because they're there for a purpose. Ask people that you think are benefiting you. And I think truly, back to the vitamin question, if it's not mega dose, I think it should be okay. But read the labels, make sure it's not 1,000% of what you need. Nobody needs 10 times the amount of a vitamin, because in industrialized countries, we fortify our foods with enough vitamins that you should be able to get it. I'm talking about the fact that, when you have foods, you go through fast foods or restaurants, that you may not get the veggies that you need, things with lots of color, then you may be missing on some vitamins, and over time that makes a difference in your performance. Most of us want the best from our lives and our children's lives, and the way to do that is you have to get the stuff that you put in. Food is medicine. If you don't get the right foods and the vitamins that are the cofactors that make your energy go, it's almost like if you have a car. Your car could be fine, it's shiny on the outside, but if you don't have enough engine oil, or if you don't have enough transmission oil, the thing is just not going to work well. The same thing with the vitamins. You can have all the food that you want, but if you don't have the vitamins, the cofactors that make it go, you're going to have lots of problems with memory, with function, reproduction, and overall health. Alertness decreases. There's so many things that you can get if you don't have the right nutrition, and people don't understand it. They go, well, I did this and that. How come I don't have the benefits that I want to? It's because you didn't put the right stuff in.